Diabetes has been around for over 5,000 years, at least that we know of, and probably goes back even farther. And for a long time, there was really very little that we could do about it. If you had insulin-dependent diabetes up until the 20s when they discovered insulin, you basically had a death sentence and you were going to succumb to the disease. If you had type 2 diabetes, you had a lot of problems because there was really no way to control it. Now we have much better technologies for controlling diabetes, very sophisticated ones. But in the last 10 or 15 years, the most amazing thing that's happened is we've learned that we can in fact prevent type 2 diabetes in people with high risk for developing the disease. Now, who are the high-risk people? Those are people that historically are overweight. Those are people that have a metabolic defect. Their beta cells don't make enough insulin, or they don't use it very effectively. Those are people that usually are very inactive, don't have much physical activity going on. Those are sometimes people of color. If you're a person who's African American, Latino, Native American, or Asian Pacific Islander, you have an increased risk for developing diabetes. It's a genetic component, part of the phenotype. Some of these people who have over time gone on to develop diabetes, we've learned that with very modest changes in lifestyle, a 5 to 7% loss of weight and an increase in physical activity, the equivalent of about 150 minutes a week of brisk walking, or about 20 minutes a day, can reduce your odds of developing diabetes by as much as 60%, which is a huge reduction. We also know that there are some medications that can be used to help you reduce your risk of diabetes, although the medications are about half as effective as lifestyle change. But there is trials that show that metformin, a drug that's been used for treating diabetes, is also useful in helping people to prevent the onset of diabetes if they have risk factors for developing the disease.